Well, our first guest is helping Alabama see a little clearer. If LASIK is not right for you, the right procedure, then ICL surgery could be. Parker Cornea in Vestavia Hills offers that, and this morning we're hearing from a patient and also a doctor's assistant. Blakeley Cain and Emma Scott are here this morning. Good morning, how are y'all?
Good.
Good, how are you?
Really great, and we get to talk to a patient this morning too about the procedure, which is rare, so it's going to be really interesting to hear your insight on this. But we're talking about ICL, so what is that, Blakeley? Well, you're the patient.
Yes.
Sorry, I'm getting two people confused. Emma, what is that ICL?
ICL is an implantable contact lens. This is a newer refractive procedure where we're able to put a permanent contact lens into the eye.
Really, really cool. Again, ICL is the word there. So is ICL, the second question here, how is it different when it comes to LASIK? Why can't you not just get LASIK? I guess LASIK is not available for everyone, or is not good for everybody.
Right, absolutely. LASIK is an amazing procedure. It's an amazing refractive procedure, but not everyone is a candidate for LASIK, such as Blakeley here, and she can speak to that experience. ICL is a great option for patients who would like a refractive procedure but may not qualify for LASIK surgery.
And going a little bit deeper here, the difference between ICL and LASIK.
LASIK is going to, it's a different type of procedure. LASIK is going to make a little flap in the cornea, allowing the patient to see better, and ICL is actually implanting a contact lens into the patient's eye based on their prescription.
Really, really cool. Again, two different procedures, and it depends on your condition of which one you would go with. So Blakeley, here are the questions right now. How do you see now compared to before the procedure?
Before the procedure, I did not have 20/20 vision. I have 20/20 vision now. I had that about 24 hours after the surgery. I was told that I was not a candidate for LASIK because my cornea was too thin. So I was told I would have to wear glasses and contacts forever. But I discovered Parker Cornea about a year ago, and ICL. Once I realized that it was an option, I knew that that was it.
After you walked out of the doctor's office, after recovery, a few weeks, a few months later, was there a moment you were like, wow, this is totally different, I can see again? What was that moment like?
Almost immediately, actually, after
Really?
the surgery, yes.
What was recovery like for you?
It was very easy, no pain. I didn't have any pain during the surgery either. Dr. Parker and his assistants and everyone took very good care of me.
And how bad was your condition before the surgery? How bad was your sight?
I was not able to see about any further from here in front of me without contacts or glasses.
Incredible. So if people out there are trying to decide if they want to go through with ICL or not, what would you tell them and why?
I would tell them that the procedure, it lasts about 10 minutes per eye, and it's very easy, and I would recommend it. I would also recommend Dr. Parker's office as well.
Exactly. Well, Emma, a great office. This is in Vestavia Hills, Parker
Yes, sir.
Cornea is.
Yes.
How long have you worked there? And tell us about the location, the office. I know it's very modern. It has all the latest technology there.
Absolutely. I've been at Parker Cornea for about 6 months now. It's located in the Liberty Park area. They just recently built this building a couple years ago, and it's got a beautiful layout. We have clinic on one side, and we have 2 operating rooms on site. It's a very efficient place, a well-oiled machine, I like to say. And it's been a pleasure to work there. Everyone there is so kind and caring about the patients.
We like to hear that. That's good news. We talked about ICL. Any other procedures you guys offer at Parker Cornea?
Absolutely, we do. At Parker Cornea, we do cataract surgeries, we do surgeries for glaucomas, we manage patients with long-term diseases of the cornea and just general ophthalmology as well.
How many ICL patients, I'm putting you on the spot here, and you may not know an exact number, but is it common to see ICL surgery? Is that one of the more common surgeries there at Parker?
Absolutely. I would say that we do probably 1 to 2 ICL surgeries per week on average.
And then Crystal, the producer, is telling me in my ear right now that you guys are internationally known for the procedure ICL, right?
Absolutely, yes, sir. Our doctor, Dr. Jack, he has trained in abroad with amazing ophthalmologists, and he's brilliant, and people come from all over to come see him.
And you guys at home can go see Dr. Parker and the entire staff there as well. Again, Parker Cornea, located in Vestavia Hills. What's the location? What is it near? And also, what's the website?
The website is parkercornea.com.
Easy. And we have it
Easy.
listed there on the screen too.
Yes, and it's a great location. It's around some really good restaurants. It's around some other medical buildings as well. There's plenty of parking, so patients don't have to fight the downtown traffic.
Again, doctor's assistant Emma